Welcome to Body by Poly. I'm Dr. Alain Polynice, a board certified plastic surgeon with over 25 years of experience. I started this podcast to have real conversations, not just about surgery, but about healing, recovery, and what it truly takes to feel confident in your body. Whether it's correcting a past procedure or pursuing a transformation you've been thinking about for years, I'm here to give you the honest truth. No hype, no sales pitch, just expert insight, hard earned experience, and the conversations I wish every patient could have and hear before and after surgery. This is Body by Poly. All right, welcome to the podcast. Today on Body by Poly, I'm super excited because we're going to be talking with a great colleague, but not only a colleague, a great friend of mine, Dr. Arnold Almonte, who is a board certified plastic surgeon, specializes in facial surgery. We're going to talk all about that, and he's in the Sacramento area. Now, Dr. Almonte, welcome to the show. Yeah. So listen, we've known each other for about 25 years now, going all the way back to New York City and Lincoln Hospital in the Bronx. Having met in New York so many years ago, that's interesting. But what I want to hear about is your journey because you have the most interesting journey starting from the Philippines to Africa, going to New York, and then to California. So tell me about that.
Yeah, I was born in the Philippines, but we left the Philippines when I was just one because both my parents were medical missionaries to Africa. And so I haven't even been back to the Philippines since that time. Grew up in Africa, three different countries, Malawi, Zaire, Ethiopia. But then when it came time from high school, I immigrated to the States to live with my grandparents in Southern California. And so that's technically where I call home in Southern California. And I throw into high school and college. And then medical school took me to Iowa. I went to an osteopathic school there in Des Moines. And then that's where I decided I wanted to become a surgeon. General surgery residency took me to New York. I actually did a couple of years in Los Angeles at Harbor UCLA as a prelim general surgery resident. And then I transferred to New York where I completed my surgery. And then I did a 1 year hand fellowship. That's where I met you. And then I did 2 years of plastic surgery in Philadelphia. So yeah, a long circuitous route, but eventually, and then after I finished plastic surgery in Philly, I made the decision to move back to California to go into practice. And so that's how I landed back here in the Sacramento area.
Yeah. Man, I thought my journey was crazy, but that's amazing. And so you're a world traveler, and that's definitely something that you've continued doing, haven't you?
Yeah, my family, we grew up with that. So it's always been part of our genes.
So listen, I have some great questions for you. But my first one is, what is the craziest case you've ever done?
Wow, craziest case. If you're going back to, way back. Oh, okay. If we're going way back, then like even during training, I would say the craziest case I ever did was the one I did with you, actually. You were my, so for the listeners out there, that was my attending. I finished general surgery and I had decided to pursue plastics. But in order to do that, I need to buffer my CV. So I decided to go into a hand fellowship, which was in the Bronx. And training in the New York, there's nothing like it. I'm sure a lot of people would agree. So I did the 1 year hand fellowship. Even though it was a hand fellowship, it was actually really plastic and reconstructive. And you were one of my, we did more than just hand, man. And so one of the craziest cases that I did was with you, where and it was literally, so it was a lower extremity reconstruction. A patient had a big tibial fracture. And basically, you were going to move the fibula, interposition it onto the tibia, and so that was the surgery. So we're going to reconstruct this lower extremity, and so I remember you were like reading the article. You said, hey, I found this cool technique. It was so bold, and I was like, I was so excited just to be part of it. So yeah, I'd say that's one of the craziest cases. And we look at the pictures of it from that case. Those are some good times. I think the guy is walking well at this point.
We did way more than hand. Yeah. I remember that case. I remember that case so well with you because we were so bold and young at that time, weren't we? The reason that I'm glad you brought up that case, and that's exactly what I was thinking about, is because it's one of those cases where this is a man, like you said, it was a truck driver, I believe, and he was in a really bad accident, nearly amputated his leg. His foot was barely hanging on, and we decided, okay, we're going to move a piece of bone, his fibula, over to the tibia to replace bone that he lost. And I think I got what, 9, 10 surgeries on this guy in the course of a year. He was there a long time. And it's one of those cases where you can only do that in a teaching hospital, but it was a complex case. And I did find an article, I think it was from South Korea, where they had done 5 cases like that. And we decided, yeah, we're going to go ahead. But I remember doing all those cases with you. And that's probably one that I would list on my top 5 craziest cases that I've done as well.
Yeah, yeah. Those are just good times. I learned so much.
They were a good time. I bring up that case to you to ask you this, like I know your background, I know where you trained, I know the crazy cases you did, not just in reconstruction, but in hand. And I guess my question is, how did that shape that background in reconstruction and doing complex cases? How did that shape your practice today, even though you're very niche now and focused on facial surgery, but how did that shape what you do now?
I think one of the things that, in fact, I remember having this conversation with you specifically about the reconstructive ladder. I remember learning that, and you said plastic surgery is about the reconstructive ladder and learning how to fix defects from head to toe, really. And so learning to do those really difficult cases where you're just correcting defects and trying to restore form and function. When you do complex cases like that, it makes you realize, man, you can really do anything. And when you go from a more complex to less complex, you just find an ease and a comfort in facing challenging cases that you really wouldn't have gotten if you didn't do those kind of cases. So I felt very comfortable in moving forward. And then as your career progresses, you find the area that you enjoy. And in my case, which is facial cosmetic surgery, again, those are also challenging in their own way, but the training back in New York, doing those cases with you, really gave me the ease and the confidence to move forward in learning even new procedures.
Yeah, that's what I was thinking because once you face those complex cases, it's not that you find the other cases easy, but it does give you that skill and confidence to tackle these things. The things that you do, especially in your case, doing your surgeries under local, I would say a lot of people probably wouldn't do that because there's really an element of challenge to that. So can you tell us a little bit about what the A lift is? Because I think that's what you call it, and how you do it, and how you develop that technique, and kind of other facial procedures that you do.
Sure. So this really is a question about like how I started even doing facial cosmetic surgery. So I think it's worth just kind of going back in history just a little bit. When I first opened my practice after leaving New York and Philadelphia, I really opened up as a general plastic surgeon. I can do it all. And you know what? You come out of residency, you're trained in all these things, and you're like, I'm going to show the world I can do all of these things. I can take care of hands, I can take care of burns, I can do face, I can do breast reconstruction, all these things. So you open up like that, and the reality of it is there's only 24 hours in a day, and you can only do so much. You can only help so many people. And what I found was, Alan, and this is just the truth, I was on staff at 4 different hospitals. I'm running around all over town taking care of so many different patients with different problems, like I said, head to toe. And I came to this realization that is just not sustainable. And it was also during 2007, 2008, the economy was changing a little bit. So, yeah, so I had to make some changes. And it was then when I got introduced to a company, I think it's okay to say their name. It was a facial cosmetic company called Lifestyle Lift. And it's a whole different story. We can talk about that on another day. But basically, I got called and invited to, hey, would you like to join this company? Would you be interested in learning and maybe doing some procedures for us in the Sacramento area? And what it was is facelifts under local. And I had never done that. In my whole training, of course, every facelift I ever did was under the classic general anesthesia. That's just normal training. But when they invited me to Michigan, which was their headquarters, and I watched this guy do a facelift under local, and I was blown away. Remember, this is back in 2005, 2006, where I was like, what? I had never seen this before. I didn't know that could be done. He's doing a facelift, and and he's talking to the lady like, "Hey, so where did you go on vacation?" and all this stuff. It was crazy. But nevertheless, I saw the model and I thought, you know what? Let me learn this. So I picked it up and I began to integrate it into my practice, all the while still mixing it with all the other procedures I was doing. And then, just to make a long story short, you know how t- you do a surgery and you really enjoy doing that operation, and you stand up and when you're through with it and you go, man, I could do that all day. And so that's the beginning of this decision I'm just going to switch my practice gradually from not only the full body reconstructive and cosmetic to just cosmetic, and then from that, even only facial cosmetic. And so that's how I began doing that. And I joined the company for a couple of years, and then they went through some turmoil and they actually closed. But then I moved on into my own practice, utilizing the same business model, utilizing the same techniques, of course, and refining it along the way. And that's how I got my start. And it just has been working ever since.
Yeah. And you've been in practice now up there doing that for about 15 years now?
Yeah, about 15 years, since 2010. So yeah, a little over 15 years.
So obviously now you have a pretty niche practice. You mean you do pretty much everything under local anesthesia. What would you say are the specific advantages of that, and are there any negatives to having such a practice?
I feel like of course, I'm biased, but I feel like there's so many advantages to this procedure because we all know that the greatest risk in any operation is always the anesthesia. Going under, and I explain this to patients, going under is the greatest risk. The surgeons, we can control bleeding, we can control a lot of different things, but man, the effects that anesthesia has on your heart, lungs, brain, those are the things that are at greatest risk. And so when you're doing a procedure that's medically necessary, you just accept those risks. But if you're doing something like what I do, which is cosmetic in nature, it's elective, man, you want to reduce that risk as much as possible. So the anesthesia is an area that we can actually reduce that risk. So local anesthesia, there's less recovery time, less post-op nausea, vomiting, anything like that. Of course, you're not intubated. There's less cardiac, obviously respiratory issues. So it's so much safer for the patient to do it under local. And then I found that we found that you can still accomplish all of the cosmetic goals even under local anesthesia. The pros are less risk, easier recovery. You don't need you don't necessarily need a hospital or a surgery center type setting. This can be done in an office-based setting. So that also means less cost, less overhead for the surgeon. And then on the con side, some patients are very nervous about undergoing just local. They're not put out. But after I talk to them and share with them kind of the details of it, they get pretty comfortable. And then once they see that others can go through it, so now over the years, plenty of patients have come through. I explain it to them and they get through the whole operation very comfortably.
You obviously perfected the technique, but do you think that it prolongs surgery time at all?
I think, listen, this actually goes to the question of when you do one thing over and over again, you just get more efficient at it and that faster at it. This Mr. Dr. Breast Reduction King, your speed just gets faster, and it's not because you're trying to go faster, you just become more efficient. So over the years, I've found that under local, you can get through a procedure faster because you can also direct the patient a little bit as well. So that helps with the overall surgery. But yeah, I think the reason why there's less operative time is mainly because of just efficiency from doing one procedure over and over again.
That's right. Right. That's right. It's like a dance and you've perfected it. No, but you do multiple combined procedures in one setting, right?
Yeah. And not only do just to answer your earlier question, not only do I do facelifts and neck lifts, but I also do upper eyelids, lower eyelids, forehead lifts, brow lifts, lip lifts. In the end, there's only so many things you can do to a face. It's not an infinite number of things. But I can tell you early in my practice, I was that surgeon that if you're on my table, we're just going to get everything done face, brow, eyelids. And that was fine. And that was okay. Nothing wrong with that. But over the years, I found that a lot of patients actually, for some patients, maybe it was too much surgery all at once. And then for another group of patients, Alan, you'll find this interesting, it was too much change all at once. I had a number of patients that were like, Doctor, you did a great job, but I look in the mirror, I really don't recognize myself, or yeah, or friends or family are commenting. So I learned from that experience. And so over the last few years, I can tell you I've backed off from this mass change type of surgery, and I'll do things in steps. Start with just your neck, lower face, and maybe the upper eyelids, and we'll come back later and we'll do the brow and the lip lift or something.
Ah, almost don't recognize themselves. Yeah. Interesting. Staging it. Yeah, it's funny you say that because I think in body surgery, it's the opposite. People are really positive about the full body change, like the complete transformation. For the face, not recognizing themselves, I think it's interesting you say that, but yeah, I've had the opposite reaction.
Yeah, no, I think body is, yeah, is exactly the full, all that should take place in one setting. I like that.
Yeah. So I know you're really into teaching. You have medical students and residents that come and shadow you and visit you. What kind of advice would you have for somebody, a young plastic surgeon coming up who would be interested in starting a practice like yours?
That's a great question because a lot of times we develop wisdom over the years, and then you go, so what would you have done differently in the past? And I don't know if I would know what I know now if I hadn't gone through all that in the past. Basically, the way I would advise any young surgeon coming up is learn as much as you can and do as much as you can early on. But then if you can, the faster you can get to that point of knowing what you really like and what you really enjoy, and then specializing in that. Because, like, I'm sure you would agree, the more you do a certain procedure over and over again, that repetition, that muscle memory, you just get really good and efficient at it. So you can't be like a master of everything. We learn everything and we learn head to toe. But when you go into practice, finding that one thing that you do that you really like and really enjoy and can get really good at, that's the way I would advise young surgeons. You like breast? Great, be the breast guy. You like face? Be the face guy. Whatever. Lipo, you want to do lipo? Be the lipo. Because I think we found even just in the marketplace, people like specialists. I myself, as a consumer, go to people that are experts in that whatever area that I'm looking for. I think people also see that in the general marketplace. And so if you're yeah, if you're a specialist, then people will gravitate towards that.
Couldn't agree with you more. But I think one of the problems and one of the difficult things to do is to give things up. When you know how to do something, when you can do something, like you, for example, you giving up doing body surgery or giving up doing hand surgery, something that you know you're good at, but it's not that thing that you have a passion for, but it's still hard to give up.
Yeah, Alain, I remember when I made that decision to just focus on face. Of course, I had done previous patients breast surgery, tummy tucks, and they'd come and say, "Oh, I'm bringing my sister or my mother," and we would tell them, "Actually, we don't do that anymore. He specializes in just the face," and so it was tough. It was tough because you enjoy those cases too.
I know, right? Yeah, and like you said, refine it and just get better and better at it. And I'm sure you're still refining things in your technique even now, because I still am.
Yeah. Oh gosh. Yeah, I'm always learning. I still go to courses and watch other surgeons, and even if you pick up one or two little details, that's already a lot.
Yeah. It's huge. Every time I go to a meeting and pick one little thing up, it was worth it. Incorporate that into your practice and you just get that much better.
Oh, a different type of suture. Okay, great. Even something as small as that, it becomes a big deal.
And you're like, why didn't I think of that? I've been doing it this way for years. And but you mentioned meetings and teaching. That's one thing that you did mention, joining an international teaching company. Can you tell me a little bit more about that and what's that about?
Sure. So there's a company that I got introduced to back in 2019, I think it was, or 18. ECAMS is the acronym, the European College of Aesthetic Medicine and Surgery. They're based out of Dublin, Ireland, but they produce courses like all over the world and mainly in Europe, but they also have sometimes in Asia. And body, face, skin, non-surgical rejuvenation like fillers, Botox. It's a whole host of teaching that they provide. And so I looked into the facial course that they were doing. So, and I went to the course. It was held in Verona, Italy. So, of course, there's a natural, hey, I want to go to Italy. So let's go there. Spent 2 days working on cadavers, and then you watch live surgery, right? So there's the cadavers, there's the didactics, and then live surgery. And this kind of method is so effective. And of course, when you go to these meetings, you meet a lot of different people, you become friends. One of the things I really enjoy is just the camaraderie because as when you're a surgeon, sometimes surgery itself is it can be, how shall I say, a lonely life because you're alone in the decision making. You have to, so when you're and managing the patient, so when you're around other colleagues who you realize they all go through the same thing. Oh, okay, that's good. So that camaraderie part of it has always been attractive to me in meetings and courses. And so because of that, I decided to become a fellow. So they have this fellowship program in that company where if you become a fellow, you can also ultimately become an instructor and that sort of thing. So that's where I feel like my career has been leading me towards. I've now built up 15 years of experience doing this under local anesthesia, for example. That's a niche kind of thing. And so I feel like I can help the next generation of surgeons learn some different techniques. And I wanted to do that on a platform that was already established. And this company provided that.
Wow, it's very interesting. When we're done, send me the link. I'd be interested to learn more about it. Yeah, you're on the cutting edge of innovation. So, what do you think the future holds for our specialty, but more specifically for your niche, facelifts?
Robots and AI are going to just take over doing facelifts. Okay, I'm just listen. I think I go to all the meetings and as you I'm sure have kept up or heard, there's a big push in recent years about the deep plane facelift and all that. And then I was trained with doing the SMAS facelift. That's what I do even presently. It's very effective and patients are really happy, at least in my hands, I can say that. But then there's a push goes to the other side of, like I said, like deep plane or what have you. Yeah, and then Kris Jenner, a celebrity, came out and her surgeon came out and said, "Oh, I do a SMAS," and so now you see the shifts maybe going backwards, shifting back. In the end, and of course, the twin studies reveal there is no difference, right? I think that surgery is one of those things where you go through these shifts back and forth of what's better, what's in the end, it's really find the surgeon that you like, that you feel comfortable with, and in their hands, what they do well. And I think that's as good as it gets. When you're at this level, they say if you ask 10 surgeons, you get 11 opinions. And that's just the reality. We all have our own little techniques, we have our own ways of doing things. So if you like that person, just go to that person. Yeah. And I think that's the way it's going to be. But yeah, I don't think there's anything really new going on. It's just that different approaches seem to get popular over time, but then that goes back and forth.
So let me ask you something. I've been to your office in the Sacramento area, and I got to say, you have a really well organized, efficient operation. What are some of the things you think that are key in putting together that perfect team, creating that harmony in the office and more importantly, maintaining staff.
Yeah, that is so important. One of the biggest lessons that I would teach anyone or a young surgeon coming up is finding the right people and to be on your staff, because you can have the greatest ideas and be the best surgeon, whatever, but if you don't have the people surrounding you, the support team, it can fail miserably or it can be very successful. The people surrounding, there's a great book. So obviously becoming a business owner and everything, I'm learning a little bit more about business. I read different books. And one of the great ones is by Jim Collins, Good to Great. And in his book, yeah, he talks about like putting the right people in on the right bus and then in the right seats. The right seats. So you have to know the seats, first of all, then you have to know the people. In my case, for example, it's a pretty basic practice. You need someone in the front, so you need a good office manager, and in the back, you need someone on the surgical side. You need a good surgical scrub tech. And when we started out, it was just the three of us, me, office manager in the front, scrub tech in the back, and we just developed each other. I taught them everything that I wanted, yeah, to be a certain way, and they're good learners. You have to start with someone who's willing to learn, someone who's willing to be taught. And if you have that, man, you can just grow into something that is really special. I've added pieces along the way and have lost some. I had a nurse who came in, then she moved on. Then I had a PA has come in and replaced her. Different pieces along the way, but if you have that core group, that's the most important thing to establishing practice. And then the rest is just details, location and all that kind of stuff.
Yeah, you've done a fantastic job because I met your staff and especially your scrub person. She's amazing. And you can tell when you have good synergy and good harmony between the two, and that makes all the difference in the OR.
And surgeons or students come into the OR and we're working and watching surgery, I always tell them that me and my assistant, her name is Smithy, and I say, me and Smithy have a no talking relationship. We don't talk. Yeah, if you have someone, and that's the thing about specialization, which going back to the original point, when you specialize and do one thing over and over, then your scrub tech will also learn all your moves. They can anticipate all your decisions. And so they're just handing you stuff. You just hold your hand out and it appears on your hand. That's pretty cool. But that only comes from years of doing it together, right? So, oh yeah, you're right. She's even corrected me on the step. She goes, no, you didn't do it. You didn't put the drain in first. Oh yeah, okay. Yeah, you're right. I got to put the drain first, and little maneuvers like that. It just makes life so much easier.
All right, a little more lighthearted thing, man. So what's your favorite thing to do on a day off? How do you spend a day off? What do you do?
I have three daughters. I just love raising them. Two of them are already, they're twins, and they're already, man, they're in their 20s. They're moved on. They're doing their own thing. So we still have our youngest one at home. She's 12. So hanging out with the family. My wife was working in the hospital, but now she's moved more into the office setting. So it's nice to be able to spend time with the family. We love going hiking. We like going out to eat. Nothing too crazy. Hiking, going out to eat, traveling. Those are the kind of the fun things that we like doing.
What's the best thing that you achieve that balance? It is important because work can be overwhelming, but it seems like you've really found that sweet spot.
Yeah, I appreciate that. Yeah. It's been a journey. We went through all of that together in the early years of the practice, went through the struggles. I've had my own set of financial struggles early on in the practice, but you learn from that. And now we moved into a place where it's okay, wow, we're doing what we always anticipated doing.
Arnold, I know you have some hidden talents. You want to tell us what they are?
Boy, I enjoy playing the piano. So it's one of those things. And I play by ear. So when I grew up, I took formal lessons as a kid, like every parent. My mom would bring us to piano lessons, whatever. And then when there was a time when we stopped with the lessons, but I just continued to play. And then I just developed being able to play by ear and hearing a song and then just playing it on the piano. So that's one of the things I enjoy doing. So that adds to your other question about what do you enjoy doing. I love just sitting down and playing the piano, and that's my art outside of the OR.
No, I can appreciate that. And that is one thing, if I don't want to say I have any regrets, but because there's still time, but learning to play an instrument is something I've always wanted to do and never done. So I can appreciate that. Tell me, what's one thing you can't live without?
My wife, listen, but just, I think being able to enjoy time with your kids, that is the one thing that we would all trade it in for if it came down to that. Well, obviously, I love surgery. I love doing what I do, being a teacher, being a business owner. All these things are fun, but family is number one, and that's what we do it for. At some point in time now, as I'm getting a little bit older in my career, you're looking at making some of these decisions which will maybe slow down the practice and more time with the family, that sort of thing. That's where I'm heading to. And so family would be my answer to that question. Yeah.
Ah, yeah, no doubt. No doubt. I have one last question for you, and I already know the answer, but I'm going to ask it anyway. Yeah, you're a board certified plastic surgeon, you're a business owner, you're an entrepreneur, you're a teacher, you're a father of three amazing daughters. How do you define success, and what are you most proud of?
Wow. Yeah, I'm most proud of being a family guy, going through the early years, raising a family. I'm sure I told you this before, but I went through a divorce early on, and that's the mom of my older twins. We're good friends, everything's good, but it's one of those lessons you learn early on in life about what's really important. And so that really refocused me into understanding that family, how important family is. And then, of course, so to me, the definition of a success is if you're able to do what you enjoy doing the most, and you're also able to balance that with a good family life. I think that's as good as it gets, Alan. It's not as good as it gets. It's not about money or stuff like that. Gary Vee, who I follow, always said, you can only wear so many trousers. And that just was a funny comment that just stuck with me. He says, so yeah, that's true. It's just all about family and then doing what you enjoy doing. If you can do that and have good health, then there it is, man.
Right. That is as good as it gets. Yeah, there it is. That's a definition of success for me as well. Arnold, I have a couple, I have 10 rapid fire questions I'm going to give you real quick, just either or, and you're going to tell me what you think, and it's going to really make me well, everybody get to know you. Ready? All right. Number one, steak or sushi?
Oh man, steak,
Morning person or night owl?
night owl. Gosh, no, no. Okay, let me change that. A morning person. Yeah.
You're a night owl? I'm both. I guess sometimes you're both. You wake up early, go to bed late, and that's right. Yeah. All right. 90s rock or classical music?
Classical, I think. Yeah.
A tough one. Classical music? Dude, really? Pink Floyd, Queen? All right. Cook at home or takeout? I
Man, takeout.
thought you'd cook at home. I really would. Yeah. How about cats or dogs?
Gosh, we have both, but I'll say dogs. Yeah.
Ah, you do. But what dogs are the dogs yours, pretty much. How about pancakes or French toast?
French toast.
Nah, 100%. Ski slopes or sandy beach?
Sandy Beach, for sure.
Really? All right. How about read a book or watch a movie?
Watch a movie.
Really? All right. Here's a tricky one. Do the laundry or wash the dishes?
Wash the dishes.
Dude, wash the dishes. That's a surgical thing for sure. You see a problem, you identify the problem, you fix the problem, you're done. Laundry, laundry is like medicine. It's like internal medicine. You put the stuff in there, you have to put medicine, you don't know what's going to happen, you wait, see the outcome, check the tests, and you never know what's going to happen. And it takes forever. Dishes, 100%. All right. Last one. Princess Tea Party or Monster Truck Rally?
Having three girls at home, I've done the Princess Tea Party. I think I'll just go with that.
Being a girl dad, I identify 100% with that. That is the correct answer, my friend. You got it all right. That is it. Arnold, it was such a pleasure having you, my friend. Dr. Arnold Almonte. Check him out on dralmonte.com or California Face Surgeon on Instagram. It was a pleasure having you, and thank you for taking the time.
Thank you so much for having me.
We'll do it again soon, especially after you join that international teaching thing. I'm sure you'll have other things to talk about. Maybe we'll do another episode. Arnold, thank you so much. Have a great time. Yeah. Bye. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.